Hello and welcome. I am Dr. Jack, and this channel focuses on helping you live a healthier, happier, and wiser life through knowledge. And I wanted to put out another quick video kind of updating people on the COVID vaccine. I know I've done quite a few lately, and please feel free to check those out before for more details if you want to know why the mRNA technology is working the way that it does for these types of vaccines and why I feel like they are very safe, as well as the data, how they work, why they work, and sort of my documentation of my experiences kind of going through the entire shots, which I've now completed. I wanted to kind of discuss two main topics today, and the reason is that patients have been coming to the clinic and they kind of all have been asking sort of the same questions. One of them is, how do I go about getting my shot? You know, I would suggest just kind of going online, doing your research, because every area is going to be a little bit different. And the two big topics to cover today is, one, I want to update you guys about the Norway vaccination situation, where they reported several deaths around the time of the residents in these long-term care facilities getting vaccinated and them unfortunately passing away. And then I also want to talk about who should basically think about having a conversation with their doctor before going and getting the vaccine. So without further ado, let's just jump straight into it. So in regards to the unfortunate deaths of those individuals in the long-term care facilities in Norway, it was first reported that 23 people died around the time shortly after getting the COVID vaccine. So these long-term care facilities, please realize that they are very, very elderly people, and quite a few of them have terminally ill diseases. And actually in Norway, in any given week in these long-term facilities, about 400 of these residents pass away because they are elderly and they are frail and have medical illnesses, in some situations, again, terminally ill. And so, you know, at the point when 23 people were reportedly passed away around the time of the vaccination, realized that about 48,000 people in these residents had been over 48,000 have been vaccinated at that point. It's a very low number, and this is unfortunately also a population that even if they did not get vaccinated, they would have been at very, very high risk of basically having complications from the COVID virus itself. And just to kind of give you some numbers in perspective here in the United States, that as of November the 7th, there were over 570,000 confirmed cases in these sort of long-term care facilities in the United States, and over 91,000 deaths came out of that number. And so it actually contributed to about 39% of deaths within the United States. And so if there is any one population that is really susceptible to severe complications from the COVID virus, it would be the elderly and the frail at these sort of long-term care facilities. The World Health Organization has actually even come out and said that they see no evidence that the Pfizer and BioNTech vaccine contributed to the deaths of the elderly people, and urged that the shot still be used. As well as on January 18th, the Norwegian Institute of Public Health investigated 13 of the 23 reported deaths, and they had not concluded that the vaccines were to blame. And actually their head of the agency told them that, quote, "These are people who are very old, are frail, and have serious diseases. It is not a given that the deaths, represent an over mortality or a causality." So in regards to who should have a conversation with their doctor, or in some cases kind of put it off or reconsider getting the vaccine, obviously if you are someone who has had an allergic reaction to any of the ingredients that are inside either the Moderna or Pfizer vaccine, and please know that for me, I'm talking about the Moderna and Pfizer vaccine because I'm here in the United States, and those are the two that are legal here and the two that I have mainly researched the most. And so if you have any type of allergic reaction to vaccines in the past, people should be made aware, but you know, this does not pertain to allergies such as to different foods or things like latex or pets, or, you know, it's not that type of allergy that you need to be concerned about. It is actually true anaphylactic allergy reactions to vaccines as in the past, as well as the contents that you see here within the two different vaccines. And also, if you are pregnant or breastfeeding, thing, the CDC suggestion is that you can go and get the vaccine, but you just have to realize that there was hardly any data on this, but they do not see where it can really be any type of long-term detrimental effects to the mom or the baby. But they, again, encourage that you have a conversation with your doctor and determine whether or not the benefits outweigh the risk, because pregnant women actually are considered immune compromised and at slightly higher risk. The other topic are children. So for the Moderna vaccine, they vaccinated anyone that was greater than or equal 18 to 18 years of age. And for the Pfizer vaccine, it was greater than or equal to 16 years of age. Moderna has started a clinical trial where they're vaccinating, I believe, people aged 12 to 17. And so they will report that data when it comes out. But as of right now, there is no data that we can point to for people that are below those age groups for each one of those vaccine groups. And please realize that, the CDC and all these other guidelines, the WHO, they're not going to be able to give you these suggestions only because there is no data. It's not because they think that somehow it will lead to long-term consequences. And again, if you look at my past videos and just sort of get educated about the new mRNA vaccine, the technology, how it works and inside your body on a cellular level, and how basically the message is like Snapchat, it gets sent and then it gets destroyed and basically just primes your immune system. So the other issue are medical conditions and people that are terminally ill. Now, obviously, after just talking about the Norway situation, this is something that you should definitely have a conversation with your doctor about, and whether or not the benefits outweigh the risk for you individually to go and get these shots. I think it will kind of take a individualized discussion with each patient as to whether or not they should move forward with the vaccination, because if they don't get vaccinated, they're at sort of the highest risk population. But if they do get vaccinated, there are possible risk involved. And again, I'm not so sure that the Norway example is a great example. So those individuals who are actively ill with COVID-19, the suggestion is that once your symptoms have subsided, that you wait 90 days before going and getting your first vaccine. The reason is that it does not appear that anyone that gets ill from COVID has shown reinfection within 90 days. So they think that you should at least wait that period of time and then go and get your vaccine. But it is still suggested that you go and get vaccinated and go through both vaccinations. So what if you are immune compromised and have something like rheumatoid arthritis or something like that? The current suggestion overall is that you still do consider going and getting vaccinated. There hasn't been any data showing that it sort of reactivates or exacerbates any type of autoimmune disorder. I actually spoke to a rheumatologist recently, and they also confirmed that they have not seen this in regards to the autoimmune disorder population for any type of various diseases. And actually the exact opposite concern is that they're afraid that individuals whose immune system isn't as strong may not be able to mount as strong of a response to the actual vaccination process. And so this is the reason why it's actually very good that the Moderna Pfizer vaccine have a efficacy rate of about 95%, because even if it's not as strong, even in the immune compromised group, their coverage is still very good. Again, keeping in mind that in order to pass the FDA and approval for any type of vaccine, it only needs to be 50% effective. It still warrants a conversation with your doctor, but that is the data thus far. And please realize that even if you get vaccinated, that it is still suggested that you wear a mask and socially distance and all these things. We need to do this at the very least until we have a significant amount of the population having been vaccinated. And the rumors are it needs to be about like 70 to 75%, somewhere around there, of people to get vaccinated to have that kind of herd immunity. And so the quicker we get it done, hopefully the quicker life will return to some sort of normalcy in the future. So if you feel so inclined to put comments down below, please make them constructive. I've put out a few COVID vaccine or COVID or mRNA technology videos, and it's interesting. Every time I put one of these videos out, I actually lose subscribers. You guys don't know because YouTube is kind of good about asking me if I want to let some comments be on there if people say are very aggressive or are cursing at me or something like that. But I get these types of comments, you know, people that say some really ugly things, and because they just simply don't believe in the vaccine, or they don't believe that the virus is real, and all sorts of beliefs. You know, if you are one of those individuals, I welcome a conversation with you in the comment section, but please make it constructive. I think that one of the problems that we see in this day and age is that we just simply don't have constructive discussions about anything anymore. You know, people would rather choose just to kind of name call and just kind of say things that are insulting. And so I hope you don't take that path, because all I'm trying to do here is basically pass along information that I have taking the time to kind of research and get it out there. And that wraps up this video. Hope you found it informative. If you did, please be sure to like, subscribe, and share these videos with anyone that you think may benefit from this information. And as always, with any information they read online, please do a you know, kind of a deeper dive for yourself and fact check it before you kind of forward it on to someone else. You know, with that, I'll leave you guys. Take care, stay safe. Bye-bye. Pura Vida.